Today we're tackling a topic that can feel a little awkward to talk about, but trust me, it's incredibly common and nothing to be ashamed of. Erectile dysfunction, or ED for short. We're going to break down the causes of ED and, more importantly, dive into some natural ways to prevent and potentially even treat it. And the best part, we're going to do it all without relying on medications. So if you're ready to take control of your health and feel more confident in the bedroom, stick around. Sometimes ED can be a sign of an underlying health condition. Think of it like this. Your body is a complex machine, and if one part isn't working properly, it can throw the whole system off balance. Take heart disease, for example. When your heart isn't pumping blood effectively, it can affect blood flow throughout your body, including, you guessed it, down there. High blood pressure can have a similar effect, damaging blood vessels and making it tougher for blood to reach its destination. Obesity, diabetes, even neurological conditions like Parkinson's disease can all play a role in ED. These conditions often involve hormonal imbalances, nerve damage, or blood vessel problems, all of which are essential for healthy sexual function. Even sleep disorders like sleep apnea can mess with your body's natural hormone production, including testosterone. The bottom line is, if you're experiencing ED, it's always a good idea to talk to your doctor and rule out any underlying medical conditions. Now, before you start pointing fingers at your body, let's talk about another common culprit: medications. Some medications used to treat high blood pressure, especially beta blockers, can interfere with nerve signals and blood flow, making it harder to get and maintain an erection. And if you're undergoing treatment for prostate cancer, like radiation or surgery, it can sometimes damage nerves and blood vessels in the area, leading to ED. Sedatives, antidepressants, even some drugs used for gastrointestinal issues can sometimes have ED as a side effect. I know it can be tempting to just stop taking your medication if you think it's causing ED, but please talk to your doctor first. They can help you weigh the risks and benefits and maybe even suggest alternative medications or dosages that might be less likely to cause this side effect. Okay, so we've talked about physical health and medications, but what about the elephant in the brain? Our mental and emotional health plays a huge role in our sexual well-being. When you're stressed out, anxious, or depressed, your body goes into survival mode. Your brain prioritizes things like breathing and heart rate over, well, getting busy in the bedroom. So it's no surprise that conditions like anxiety and depression can often lead to ED. Even everyday worries like work stress, financial troubles, or relationship problems can take their toll on your libido and your ability to perform in the bedroom. And then there's performance anxiety. If you've experienced ED before, you might start to worry about it happening again, creating a vicious cycle of stress and anxiety. Low self-esteem and negative body image can also play a role, leading to feelings of inadequacy and making it harder to relax and enjoy intimacy. Let's talk about lifestyle, because the choices we make every day can have a huge impact on our performance between the sheets. First up, smoking. We all know smoking is bad for our lungs, heart, and pretty much every other organ in our body. But did you know that it's also a major buzzkill in the bedroom? Smoking damages blood vessels, restricting blood flow and making it way harder to get and maintain an erection. Plus, it can lower your testosterone levels, which is like taking the lead actor out of your libido's big performance. And speaking of buzzkills, let's not forget about excessive alcohol consumption. Sure, a glass of wine or a beer might help you unwind, but overdoing it can actually have the opposite effect. Too much alcohol can interfere with nerve signals, mess with your hormone levels, and even make it harder to achieve orgasm. Then there's drug abuse, which can wreak havoc on your entire system, including your sexual health. We are what we eat, right? Your body deserves premium fuel to perform at its best. So what does a performance-enhancing diet look like? It's all about balance. Think of your plate as a basketball team. You need a star player, veggies, a strong supporting cast, fruits, whole grains, and a reliable bench, lean protein. Cut down on sugary snacks and processed foods. Load up on fruits, vegetables, and whole grains. Take control of your health by knowing your numbers. Regularly check your blood pressure. High blood pressure is a silent killer. Monitor your cholesterol to prevent heart disease and stroke. Keep an eye on your blood sugar to avoid diabetes complications. Time to get moving. Exercise isn't just about looking good at the beach, it's about feeling good everywhere, especially in the bedroom. Regular physical activity is like a magic pill for your entire body, including your sex life. Exercise helps you maintain a healthy weight. Obesity is a major risk factor for ED, so shedding those extra pounds can make a world of difference. But it's not just about weight loss. Exercise improves blood flow, strengthens your heart, and boosts testosterone levels, all essential ingredients for a healthy libido and strong erections. And here's the best part. You don't have to become a gym rat to reap the benefits. Aim for at least 30 minutes of moderate intensity exercise most days of the week. That could be brisk walking, jogging, swimming, biking, or anything that gets your heart rate up and makes you break a sweat. Let's talk about making positive changes for your overall health and well-being. Kick those bad habits to the curb. First up, smoking. Quitting smoking improves blood flow and sexual function. Next, alcohol. Moderation is key. Excessive drinking can interfere with erections. Stick to the recommended guidelines. Concerned about medication? Talk to your doctor. They can suggest alternatives. These changes can profoundly impact your health and well-being. Let's talk about the importance of a good night's sleep. When you're sleep deprived, your body produces more of the stress hormone cortisol. And cortisol, my friends, is like kryptonite to testosterone. It suppresses testosterone production, which can lead to low libido, fatigue, and yes, you guessed it, ED. Sleep is essential for muscle recovery, cell regeneration, and hormone regulation, all of which play a role in sexual health. When you're well rested, your body is better equipped to handle stress, regulate hormones, and perform at its best, both in and out of the bedroom. Most adults need around 7 to 9 hours of quality sleep per night. That means creating a relaxing bedtime routine, avoiding caffeine and alcohol before bed, and making sure your bedroom is dark, quiet, and cool. So there you have it, guys. Natural ways to combat weak erections and improve your sexual health. Remember, taking care of your physical, mental, and emotional well-being is crucial for a satisfying sex life. If you've tried making these lifestyle changes and you're still struggling with ED, don't worry, you're not alone. It's important to remember that ED is a medical condition, and there's no shame in seeking professional help. Talk to your doctor. They can help you determine the underlying cause of your ED and recommend the best course of treatment for you. Thanks for watching, everyone. Don't forget to give this video a thumbs up if you found it helpful, share it with your friends, and subscribe to the channel for more health and wellness tips. Stay healthy, stay informed, and take care.